Well, today I'm going to talk about blindness. Let's start out with kids, and they have a cornealoplasty, a clear part of the eye where light goes in to the eye through the iris into the through the lens of the eye and down into the lining of the globe of the eye itself, okay, the retina. And when you get an opacity, a white opaque covering of the cornea, this is caused by a vitamin A deficiency. Okay, sometimes a surface layer of ulcer. It's called keratoconus because the inside layer kind of bulges out. And this is caused almost always by gluten intolerance. These kids will also have rough areas in the back of their arm called keratosis, also caused by vitamin A deficiency. And they need to be put on a obsessive, I have to use that word heavily, obsessive gluten-free diet, no wheat, butter, and rhinos, because it's almost always at the bottom of this where they cannot absorb efficiently beta-carotene or vitamin A, which is a very big, clumsy molecule, absorbed with difficulty under ideal circumstances, and certainly when you have gluten intolerance, and babies are born with gluten intolerance. They're breastfeeding. The mama passes on a gluten intolerance to them. Their mother's eating whole grain breads and cereal for breakfast, and gluten's come through the breast milk. These kids will get a corneal opacity, and if you don't deal with it, they will be permanently blind and need a corneal transplant as soon as possible. Then, obviously, if they get on the 90 essential nutrients, and we've got to do it by body weight for that kid, the vitamin A and the 90 essential nutrients will support and promote a healthy main repair of that cornea. Okay, so you can't deal with it before it gets to the point where they need a corneal transplant. Okay, the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 essential fatty acids. I would get a hold of that CD saying, seeing is believing. Okay, seeing is believing. And then there's cataracts in adults. And if you catch them early enough, the doctor looks in your eye and says, you know, you've got some early start of a cataract here. We need to look at you every couple of months. And as it progresses, it'll reach a point where you're going to have a lens transplant. You're going to need a cataract surgery. Well, if you catch it early enough, you take the 90 essential nutrients with some antioxidants, stop all the free radical damage, no fried foods, no processed meats with nitrates and nitrites, no oils, no olive oil, coconut oil, margarine, mayonnaise, salad, cooking oils, no gluten, no wheat, no barley, and oats. Get rid of all the inflammatory stuff. And take the Healthy Brain and Heart Pack, 1 per 100 pounds of body weight. Support maintenance and repair of that lens. Take the Vision FX capsules. Take 3 of those twice a day per 100 pounds of body weight. And they're, in the earliest of stages, cataracts are reversible. It will reach a point at which you can stop the progression of it, but it won't go back to normal. And so you're going to require some serious glasses. And then it reaches a point at which there's nothing you do to stop it, and it will go on to a full-blown cataract, and you're going to require some cataract surgery. Okay? Then there's glaucoma. You get obstruction of little microscopic arteries in the eye, and the pressure in the eye goes up, and they put drops in your eyes that help lower the pressure. But again, glaucoma, you have to deal with the vascular system. So I like, again, 1 Healthy Brain and Heart Pack per 100 pounds of body weight, and you throw in to enhance blood flow through obstructed arteries in the eye, get the pressure down. You want to go ahead and add to the Healthy Brain and Heart Pack, 1 per 100 pounds of body weight, add the Ultimate Cardio Stick, 1 per 100 pounds of body weight. And, of course, you tear off the top, put the powder in a 12, 14-ounce bottle of water, and sip on that once or twice a day. But, it's 1 per 100 pounds of body weight. So if you weigh 150 pounds, I would go ahead and take 2 of them, one at breakfast, one at dinner. And, don't stop the drops until you have your eye tested and check the pressure, and the doctor will help you reduce and finally eliminate those drops. Then macular degeneration. Again, I want you to get a hold of that CD, Seeing is Believing, and get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. Get a hold of my newest DVD, Somebody Needs to Go to Jail, my newest CD, Public Enemy Number 1, and you'll know what to do here. But macular degeneration is a very common disease of the eyes of older people, as it happens to be an accumulation of the same pigment you see in age spots and liver spots on older people's hands and face. And the goal here is to get rid of that, so you get light through the retina of the eye. And again, the details are in the CD, Seeing is Believing. And I would go ahead and again, take 1 Healthy Brain and Heart Pack for 100 pounds of body weight. I would also take the ORIC points, get your ORIC points, your antioxidant points, above 100,000 a day. You could do that with 3 of the Triple Treat chocolate twice a day for a total of 6 a day. You can do it with 5 of the Cell Shield RT2 capsules twice a day. And you can also use 3 of the new Beyond Tangerine tablets twice a day. That'll get you over 320,000 auric points a day. Again, the whole purpose here is to support the immune system, support the defenses in the eye, get the immune system going, and so it'll help your body with those higher auric points, is to help your eye remove and support the removal of that pigment out of the eye so you can get light into the retina again. All blindness in the eye is preventable, whether it's corneal opacity, keratoconus in young kids, or cataracts, glaucoma, macular degeneration in adults. All of these causes of blindness are totally preventable. Get a hold of the CD, Seeing is Believing, get a hold of the books, Epigenetics, the DVD, Somebody Needs to Go to Jail, and the CD, Public Enemy #1, and live to be over 120 and be able to see the whole time. What a concept.